Ultrasonic guidance for endomyocardial biopsy, imaging supervision, and interpretation. The physician takes a biopsy of muscle tissue from within the heart guided by ultrasound. The physician threads a biopsy catheter to the heart through a central intravenous line often inserted into the femoral vein and takes tissue samples of the heart septum. Ultrasound-guided compression repair of arterial pseudoaneurysm or arteriovenous fistulae, includes diagnostic ultrasound evaluation, compression of lesion and imaging. After sedation, the pseudoaneurysm or arteriovenous fistula is examined with a duplex scanner. The physician applies directed pressure to ablate the pseudoaneurysm while blood flow is maintained. Continuous compression is maintained for 10-minute intervals, 20-minute intervals if the patient is anticoagulated, until the pseudoaneurysm is thrombosed. If thrombosis has not occurred after 4 intervals, further attempts to non-invasively thrombose the aneurysm are usually abandoned. If successful ablation has occurred, the patient is kept flat in bed for 6 to 8 hours with a sandbag on the groin. At 24 hours, the patient is re-examined for evidence of pseudoaneurysm recurrence. At the completion of ablation, the arteries and veins are assessed for patency with the duplex scanner.
Ultrasound guidance for vascular access requiring ultrasound evaluation of potential access sites, documentation of selected vessel patency, concurrent real-time ultrasound visualization of vascular needle entry, with permanent recording and reporting. The site over the access vein, e.g., subclavian, jugular, is injected with local anesthesia and punctured with a needle or accessed by cut-down approach. A guide wire is inserted.
A subcutaneous tunnel is created using a blunt pair of forceps or sharp tunneling tools, over the clavicle from the anterior chest wall to the venotomy site, which is dilated to the right size. The catheter is passed through this tunnel over the guide wire and into the target vein. Report 76937 for the ultrasound guidance used for this procedure, including the evaluation of potential vascular access sites or the patency of selected vessels, guidance during needle entry and catheter manipulation, and verification of final catheter positioning. Ultrasound guidance for, and monitoring of, parenchymal tissue ablation. Ultrasound guidance is used during tissue ablation of a vital organ. Report this code when intraoperative ultrasound guidance and monitoring is done with laparoscopic or open ablation. Ultrasonic guidance for intrauterine fetal transfusion or cordocentesis, imaging supervision and interpretation. The physician performs a blood transfusion to a fetus or inserts an amniocentesis needle through the abdominal wall into the umbilical vessels of the pregnant uterus and obtains fetal blood guided by ultrasound. For fetal blood transfusion, the physician locates the umbilical vein. A needle is directed through the abdominal wall into the amniotic cavity. The umbilical vein is pierced and fetal blood is exchanged with transfused blood. Ultrasonic guidance for needle placement, e.g., biopsy, aspiration, injection, localization device, imaging supervision and interpretation. Ultrasonic guidance is used for guiding needle placement required for procedures such as breast biopsies, needle aspirations, injections, or placing localizing devices. Once the exact needle entry site is determined along with the depth of the lesion, the optimal route from the skin to the lesion is decided. The needle is inserted and advanced to the lesion under ultrasonic guidance. Ultrasonic guidance for chorionic villus sampling, imaging supervision, and interpretation. The physician aspirates cells from the chorionic villus, early stage of the placenta, under ultrasonic guidance. In the transcervical method, A catheter is inserted through the cervix and into the uterine cavity toward the chorionic villus or early placenta. Aspirated cells are obtained for abnormal chromosome analysis. The transabdominal approach can be done throughout pregnancy, while the other approaches are usually done between 9 and 12 weeks gestation. Ultrasonic guidance for amniocentesis, imaging supervision, and interpretation. The physician withdraws fluid from the amniotic sac under ultrasonic guidance. Following preparation of the skin and administration of a local anesthetic, a small gauge needle is introduced into the amniotic sac and fluid aspirated. Ultrasonic guidance for aspiration of ova, imaging supervision, and interpretation. The physician aspirates ova under ultrasonic guidance. Following preparation of the skin and administration of a local anesthetic, a small gauge needle is introduced into the ovary and the ova are aspirated. Ultrasonic guidance for interstitial radioelement application. Ultrasonic guidance is used for the accurate guiding and placement of an interstitial radioactive implant into a tumor during the course of brachytherapy for malignant neoplasms, such as in the prostate. Radioactive implants may be enclosed in various apparatus modes such as tubes, needles, wires, or seeds. Common materials used are radium, cobalt-60, cesium-137, gold-198, and iridium-192. Ultrasonic guidance, intraoperative. Ultrasonic guidance may be used by the physician intraoperatively during many different types of operations on various areas of the body. Examples of intraoperative ultrasonic guidance include evaluating tissue removal in anatomical structures such as the breast, brain, abdominal organs, etc. This procedure may also be used to determine the location and depth of incisions to be made. This code is not to be used for ultrasound guidance for open or laparoscopic radiofrequency tissue ablation. Gastrointestinal endoscopic ultrasound, supervision, and interpretation. The physician uses endoscopic ultrasound to examine the esophageal and gastric wall. The physician passes an endoscope equipped with the ultrasound transducer through the patient's mouth into the esophagus. The esophagus, stomach, duodenum, and sometimes jejunum are viewed through ultrasonic images to determine the extent of cancerous tissue. Ultrasound bone density measurement and interpretation, peripheral site, any method. Densities are measured at the wrist, hip, spine, or calcaneus. The studies assess bone mass or density associated with such diseases as osteoporosis, osteomalacia, and renal osteodystrophy. This code reports using low-level ultrasound for measuring bone density instead of ionizing radiation. Ultrasound, targeted dynamic microbubble sonographic contrast characterization, non-cardiac, initial lesion. Plus 76,979 each additional lesion with separate injection. Microbubbles are approximately the same size as a red blood cell and are made up of a gas, example perfluoro gas, enclosed with a phospholipid shell and have the ability to reflect ultrasound waves, enhance the reflections of the ultrasound waves, and create a unique image. The microbubbles are administered using a small bolus or via continuous intravenous infusion into the circulation system and remain in the bloodstream for about 5 minutes. The system subsequently produces a contrast-enhanced real-time image. Report 76,978 for the initial lesion targeted and 76,979 for each additional lesion with separate injection. Ultrasound, elastography, parenchyma, e.g., organ. First target lesion. Plus 76,983 each additional target lesion. Although the most common clinical application for use is for chronic liver disease, tumor identification using this imaging modality is also effective since tumors are usually stiffer, or less elastic, than the surrounding soft tissue. The ultrasound technician takes a normal image followed by an image while pushing down or compressing the organ area. This happens multiple times and the images are generated in real time by using algorithms to give a clearer picture of the motion of the tissue being imaged. Report 76,981 for imaging of an organ, 76,982 for the initial target lesion, and 76,983 for each additional target lesion.